Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs. Welcome to a special bonus episode of rePROs Fight Back. I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, you would think that since it has only been a week since we have talked, I'd be like, you know what? No, it just changed. Nothing really to add. But y'all, so much stuff has happened in the last week. And again, unfortunately, most of it is trash, terrible things. The unrelenting assault on abortion rights and trans youth is just unending, right? Like, still happening, so many things happening at the state level. I don't want to focus on any of it, y'all. I don't want to talk about it right now. Like, I am recording this on the day that Justice Ketanji Brown Jackson was confirmed. So I want to sit in that joy. So let's just do that, right? Let's just focus on the joy of the Senate confirming the first Black woman as a Supreme Court justice. Y'all, this is historic. It is so wonderful. I am so excited to see that we are going to have this wonderful, wonderful Black woman on the Supreme Court. I'm just so happy. It is just a historic moment, and there's just so much to celebrate right now. I also found interesting, and it's really weird that it really hit me so strongly when I read it, because if you think about it for like a second, you're like, well, duh, that's obviously the case. But still, I don't know, it just took me aback for a second, and that this is going to be the first time in the Supreme Court's 230-year history that there will not be a white male majority on the Supreme Court. That I don't know why it bowled me over so much when I read it, because, if you think about it for a second, that's obviously true, right? For so much of the history, it was just all white men. So, yeah, now would be the first time that we're not seeing a white male majority, obviously. But I still find it just so striking, and just thinking of all of these other experiences and voices that are being brought to the court to make sure that we're getting hopefully closer to a more just world. And having the first Black woman on the Supreme Court is for sure a step in the right direction to get to a more just world. And I am just so ecstatic and just sitting in the joy today of soon-to-be Justice Ketanji Brown Jackson being the first Black woman on the Supreme Court. It's so exciting. And, so often we talk about living through history because it was all of these terrible things, right? The pandemic or the previous administration and all of the many things that happened then. And man, I don't want to live through history anymore. This is history I want to remember, right? I want to remember the first Black woman being confirmed to the Supreme Court. So congratulations, Justice Jackson. I cannot wait to see what you bring to the court. I cannot wait to see the opinions you write. Or maybe right now, more with the heavy conservative majority, the dissents you write. I'm so excited. And so let's take this time to celebrate the huge victories, right? It's a huge victory, before we start stressing about all of those other things I mentioned at the beginning about this unrelenting assault on abortion rights. Let's sit in the joy for a little while. I feel like right now, working in rePRO, joy has been a little few and far between to sit in. So I am definitely going to enjoy at least taking this weekend and next week to just sit in the joy of we're going to have the first Black woman on the Supreme Court. And I'm so excited. So with that, let's turn to this week's episode. So this week is Black Maternal Health Week. And so I couldn't think of a person that I would rather talk to than Dr. Jamila Taylor at the Century Foundation. Jamila is so wonderful. She was one of the first people I talked to when I was talking about the idea of starting this podcast and was starting to just get temperature read from friends and colleagues. And I still had a lot of doubt if it was the right move for me. I wasn't sure that I was the person to do it, that I should do it, that a podcast was a good idea. And I just remembered Jamila being a really big cheerleader, like right from the beginning, and thinking it was an amazing idea. And it really made a difference, right? To have somebody I respected so much be a cheerleader for me. So since Jamila's probably listening, thank you, Jamila. I am so grateful that she has been on the podcast a couple times, and I'm very excited to have her back today to talk about Black maternal health. So with that, let's turn to my interview with Dr. Jamila Taylor. Hi, Jamila. Thank you so much for being here today.
Hi, Jenny. Thank you so much for having me.
So before we get started, do you want to do a quick introduction of yourself and include your pronouns?
Sure. Well, thank you to everyone for tuning in today. I'm Dr. Jamila Taylor. I serve as the Director of Healthcare Reform and Senior Fellow at the Century Foundation, a 100-plus-year-old think tank with offices in Washington, D.C. and New York. Healthcare policy is one of our focus areas. We also work on issues around the economy and jobs, international policy, as well as education issues. I've been working in the reproductive rights and justice space for over 2 decades now. And one of the issues that is near and dear to my heart in that context is maternal health. So really excited that Jenny has invited me here today to talk about the issue. Before I started working in advocacy and policy, I did a long stint on Capitol Hill, working for Congressman Bobby Scott of Virginia. And I've also held a number of positions in advocacy organizations, both in the reproductive rights and justice space, as well as healthcare and HIV/AIDS.
I am so excited to have you here. One, because I'm always excited to have you on. But two, if we're going to talk about Black Maternal Health Week, I couldn't think of a better person to talk to than you. So thank you for being here.
Great. I'm happy to be here.
So maybe we'll just start at the beginning and what is the status of Black maternal health right now?
Yeah. Well, I hate to sort of start off the conversation, with some sobering statistics, but to be honest, the status of Black maternal health right now is that the maternal mortality crisis in this country is getting worse. Just last month, the Centers for Disease Control and Prevention issued some new statistics on, sort of where we are in terms of the maternal mortality rates in this country. Black women are about 3 times as likely to die of maternal health issues, maternal morbidity, the rates between Black and white women are much more higher. And we also know that over the last year or so that we've seen the rates increase largely due to the COVID-19 pandemic. Prior to this past, update in terms of the stats, we didn't have much data available on Hispanic women. And we saw that their mortality rates actually raised by 44% in 1 year. Again, we're looking at these stats and recognizing that the COVID-19 pandemic has had a huge impact on this increase that we're seeing. So in a nutshell, the maternal mortality crisis in this country is worsening.
Which, that is just devastating because it was already terrible and already a crisis before it got worse.
That is absolutely true. And the thing that makes it, I think, super shameful. It's already shameful, but the fact that, as a country, we spend more per capita on healthcare than any other country, and we also have the worst maternal mortality rates than any other similarly developed country. And so this is an issue that, quite frankly, we have the tools to address. And I know we'll talk about that more in the program today. And a lot of it really comes down to, how are we treating, particularly Black women and other women of color in the healthcare system. Based on the research that TCF has done, my organization, as well as a host of others, we know that racism is actually a root cause of, why we're seeing such high maternal mortality and morbidity rates among Black women and other women of color. And so we'll have to root that out, if we really want to address this issue adequately. But there are also a host of other things that we'll also talk about in the program today.
Yeah, and that really gets to, I was going to ask, because we had, I think the first time you were on, we had this conversation of like, what is causing the Black maternal mortality rate to be so much higher? And I think that's a really important point, because I think a lot of people see that it's higher for Black women and assume it's because of race and a race-based issue and not a racism issue. Do we want to expand on that a little bit?
Sure, absolutely. I think it's easy for folks to sort of point to race as a factor in an issue like this, right? Because then it would be easier for us to sort of unpack the issue. But quite frankly, research shows that racism and the experience of racism has an impact on Black health to the point that it causes, our defenses to be lowered. It causes us to have both mental and physical and emotional health challenges. It causes a wear and tear on the body, concept also known as weathering. And again, all of these things are well documented. And so we know that because of those things, when a Black woman presents with a pregnancy, it does cause her to have her defenses reduced. And that means that she's more likely to experience complications in the pregnancy and birthing process. I think another aspect of this, which also fits within the conversation about racism, is the fact that we're also more likely to experience racist experiences at the hands of our providers, right? And, there's a lot of conversation, I think, in the public health field. I think more recently, we're seeing it, more of those conversations, a lot of that in the backdrop of COVID. There's more of a conversation about how do we address racism among healthcare providers within the healthcare system. Some of those conversations have focused on, increasing access to, implicit bias training for providers, making sure that everyone in both the front and back office are adequately trained in to address implicit bias. But also, too, a part of that is making sure that we develop and implement anti-racist health policy. And so that means we want to make sure that everyone has access to affordable, quality health insurance coverage and health care. It means that, the services that, we need to access pregnancy-related care is affordable to everyone. It means that we need to make sure that maternity care wards are available in all neighborhoods so everyone has access to them. And so it really is a multifactorial approach. But again, racism is at the root of all of these things.
I mean, I kind of feel like that's a universal statement.
I think so too. I think you're right. I think, look, if we were having a conversation today about, heart disease or, again, I mentioned COVID-19, I think, we'll see some of the same, I think, trends when it comes to health and health concerns for people of color in this country. And again, because we experience those racist experiences, it does cause our defenses to be lowered and cause us to have poorer health outcomes. But again, these aren't things that we cannot address both through public policy and our approaches to public health.
So I think the conversation around Black maternal mortality has just been progressively getting louder and louder and louder for the last quite a few years. But I think one of the points that it really brought kind of this explosion of a broader audience understanding racial disparities was COVID, right? You started to see a much larger conversation happening around it. And unfortunately, you're still seeing how that's impacting maternal health. But I think it was good to see it grow broader. But you're still seeing these huge impacts of how COVID then is impacting Black maternal health.
Yes, we are. And, I think the thing with COVID is, I think it's important to start with the simple fact that, COVID-19 has had a disproportionate impact on people of color in this country, particularly Black and Latino populations. And that also has meant that pregnant people that are part of those populations have also been disproportionately impacted by COVID. And what we know is that, when a pregnant person presents with COVID, it could cause complications in their pregnancy and in their childbirth. It could cause preterm birth, a low birth weight, in infants, and really cause the pregnant person to be ill. And so that has had an impact on, how we've seen our maternal mortality rates go up, particularly, among Black and Hispanic women in the last year or so. And so I think when we saw these new COVID-19 rates, as well as the maternal mortality rates be released and sort of look at them side by side, it was clear that COVID-19 has had an impact. I think another thing I'll add too is that early on in the pandemic, we did see, a number of hospital systems, implement policies to basically say that pregnant people could not have a loved one or companion, coming into the hospital with them, whether they were coming in for appointments or even in the birthing process. And whereas we understand that, the systems were thinking about the health and well-being of other patients and workers in the hospitals, a situation like this did have an impact on Black and other birthing people of color, largely due to the fact that it's so important for us to, and I'm a Black woman, so I can say us, it's so important for us to have a companion or advocate with us in the birthing process. And a lot of that is due to the fact that, one, what I mentioned earlier about the likelihood of experiencing racism within the healthcare system, and also just having someone there to be your advocate. Ideally a doula, a person that serves as an advocate, for pregnant women and their families, either in hospital settings or even outside of hospital settings is really important. And so those policies, whereas again, they were put in place to help protect others from COVID-19, it did have an impact on Black and brown birthing people. And so, birth justice advocates swooped in there to do what we could in order to help to lift some of those restrictions. And part of our thinking behind that and part of our approach was to share what we know about research and the importance of having a doula or support person in there with the birthing process for families.
Yeah, the data was pretty clear that makes a huge difference. And yeah. So good to see that that's really been lifted in a lot of places and hopefully stays that way if we have, more waves of COVID.
I hope so. Another part of it too is that, the same communities that have been disproportionately impacted by COVID it's also been harder for them to access treatment and as well as the vaccines. And that has also been the case for pregnant people. And so I think as we sort of move into, the next phase of, how we're addressing COVID and how we're approaching it from a public health perspective, it's still going to be essential to make sure that, that care and treatment and the vaccines remain available to everyone, particularly to, communities of color and pregnant people. And so that's going to have to be centered in whatever strategies we move forward with. And I know the Biden-Harris administration is trying to do that, but they will also need the support of Congress to fill the gaps with the funding that we continue to need to adequately address COVID-19 and in turn, some other health concerns, including the maternal health crisis.
So another area where people of color, particularly Black women, are disproportionately impacted is with abortion access and abortion restrictions. And I think, we tried to talk about it on the podcast, how that is interrelated to maternal health and how they play together. But I think it's always important to have that conversation of the intersection of restricting access, especially in a possibly post-Roe world soon. How is that going to interplay with Black maternal health?
Yeah, absolutely. And, I'll start off by saying, anyone who is working in the reproductive justice space who both cares about maternal health and the gains that we're trying to make in that space are critically concerned about, the direction that we're going in when it comes to protecting, the access to and right to abortion. I think we see these issues, sort of intersect when, the fact that we're already experiencing a maternal mortality and morbidity crisis in in this country when it comes to Black and brown women. And if you tack onto that, restrictions on abortion care, or, the fact that abortion may be out of reach, for millions of women, that is only going to worsen our already bad maternal mortality crisis, right? For women that would like to have an abortion, that would like to choose to have an abortion because it just may not be the right time for them to get pregnant and have a child, having access to abortion is essential, and it's healthcare. It should be available to all people who need it. And so I think that we are rightfully so alarmed about what could happen if we see Roe overturned. And quite frankly, I just don't think that as a country, we're prepared to deal with, a worsening, maternal mortality crisis that is going to be compounded by, a lack of access to abortion care for millions of women. I'll also say too, that there are other factors at play here, right? So we're not only talking about access to vital healthcare services, we're talking about the intermix of other oppressions that Black and brown women experience, whether it's, housing insecurity, the likelihood of experiencing violence in our neighborhoods, not having access to transportation or adequate nutrition. All of those things, are really what reproductive justice is about. When we use that framing, it's really to sort of focus on the intersecting oppressions that have a disproportionate impact on people of color in this country. And having access to quality, affordable maternity care, as well as abortion care, are key to a person's reproductive life. And, we are rightfully really scared about this. And I think still thinking about how to adequately approach it, to be quite honest. But I think it's important to lift up these intersections, particularly for those that care about maternal health and that are advocating for increased investments in maternity care and other supports for pregnant people. Abortion should also be a part of what you're advocating for if you care about maternal health.
Yeah, and I think one of the things that is always really striking is seeing the states that are the most likely to ban abortion, or the states that have already really restricted access, are states that have a real maternal health crisis happening in them. Not that the maternal health crisis is nationwide, but those are definitely some of the worst states for it. And so it is something that I worry about as well.
Yeah, absolutely. So the states that are more likely to pass the most draconian abortion restrictions are also states that have poor maternal health outcomes. These are states that have the highest maternal and infant mortality rates. To be quite honest, most of them are concentrated in the South. Is also a place that, tends to be a hotbed for a number of, public health concerns, as well as a part of the country where, almost half of African Americans live in the South. And so there are so many different pieces to this. And again, I think the conversation that we're having today and sort of showing the intersectionality in not only access to abortion, maternity care, but also these other sort of social determinants of health, as well, and how they sort of interface and connect in a person's life to really sort of give us a picture of their overall well-being.
Okay. That's enough focusing on the problem, because it is a big problem. Let's turn to solutions. So what can be done to improve Black maternal health?
Well, there's a lot that can be done. I mean, first and foremost, we cannot have this conversation without talking about the landmark legislative package, the Black Maternal Health Momnibus, which was led and introduced by our fierce leader, Congresswoman Lauren Underwood, as well as Alma Adams and others in the Black Maternal Health Caucus. The Black Maternal Health Momnibus is a comprehensive package of 12 bills that address almost every dimension of the Black maternal health crisis, including issues around climate and maternal health, maternal vaccinations, the social determinants of health, supporting incarcerated moms with the care and support that they need, as well as a whole host of other issues. And, we have been lucky this year. We've seen some of those investments actually be included in the Build Back Better Act version that was passed in the House of Representatives early this year, and recognizing that things are sort of gridlocked right now when it comes to Build Back Better. But, as Congress considers to, think about what's going to happen with that package and, the any other iterations that it could take. We're really hoping that the maternal health investments are maintained in that package. I think another key piece to mention too is insurance coverage. Right now, the Medicaid program, which funds, about half of all births in this country, unfortunately, the program drops pregnant people off of coverage just 60 days after giving birth. And that does not make sense, particularly in a pandemic, as well as, in a country that's grappling with a maternal mortality crisis. And so we've also been advocating for a full year of postpartum coverage extension under the Medicaid program. And so there are investments included in the Build Back Better Act to support this, as well as standalone bills like the Mamas Act and others that would also support this coverage. And then I'll also say that some states have started to, submit Section 1115 waivers, which are, demonstration projects submitted to, the federal government to expand or extend coverage under the Medicaid program. So a couple of states have been approved for those 1115 waivers for extensions. But, what we're trying to do with having, these fixes as part of Build Back Better is that we want this to be mandatory and permanent so that every woman in every state has this coverage. And so those are just some of the, things that, advocates have been cooking up over the past few years to address this crisis. But there's obviously always going to be more work to be done. But if we can just get these things over the finish line, I think that's going to be revolutionary when we think about where we are right now, where we need to go in terms of addressing this crisis once and for all.
It's been really exciting to see, one, the administration's commitment on this issue, and two, to see how far the Momnibus came this year. It was really exciting just to see it advance so far and to get a lot of it into the Build Back Better that was passed through the House. I'm hoping that you guys get it across the finish line. But yeah, some of these things, they take so much time to get going, but I feel like this has really good momentum behind it.
I like to think so. And then I think another thing to add to, there's been so much conversation about, sort of Build Back Better and the price tag. And I think I'll say too, with the investments that are included in the package, that focus on the Momnibus, as well as the postpartum coverage extension, we're talking about a total of about $3 billion. And compared to some of the other investments that are included, this is not huge. When you think about the return of investment as well, the Century Foundation, has done research to look at, how many women would be impacted, with the postpartum coverage extension. And based on our estimates, over 1 million women be able to access coverage for a full year after giving birth if the Build Back Better Act provisions were to pass and move forward and signed into law. And so that would be huge, for our women who are in desperate need to have that coverage continue, especially in such a sensitive period, after giving birth. And we also know too that it not only impacts their mental, emotional, and physical health, but also the health of their infants as well.
I mean, that's just life-saving care and life-changing care.
Absolutely. Absolutely.
Okay. So we always like to have, what can our audience do? I always like to end with that because sometimes all of the stuff can feel so paralyzing. There are so many things happening. So what actions can our audience take to help in this area?
Well, first off, I think that, for those that are listening in, we've talked about so many issues, during this conversation, not only Black maternal health, but also access to abortion and some of the other issues that are so critical and important when we look at the intersectional nature of, a pregnant person's life. So I think if you want to be supportive, I think the first is to, call your members of Congress and encourage them to co-sponsor the Black Maternal Health Momnibus if they are not already on that. Also issue your support of the Build Back Better Act, the maternal health investments that were included there. And then I think also too, we can't do this work without also, again, supporting and ensuring access to abortion care. And so I think keeping your ears to the ground, supporting abortion funds in your states to make sure that they have the funding they need to support pregnant people. And then also weighing in both in in state legislatures as well as at the federal level about your support for abortion care. At the federal level, there are amazing bills that have been introduced to support access to abortion, the Each Woman Act, as well as the Women's Health Protection Act. So reach out to your members of Congress and issue your support for that. But there's plenty of work to go around and plenty of ways that you can engage and stay looped in with the work that the broader reproductive rights and justice community is doing on these issues.
Well, Jamila, thank you so much for being here. As always, it was a real pleasure talking to you.
Thank you so much for having me, Jenny. It's always great to be here and speaking to an old friend, and continue with the great work that you're doing with the podcast and all the other things.
Oh, thank you.
You're welcome.
Okay, y'all, I hope you enjoyed my conversation with Jamila. I had a wonderful time talking to her. It was great to catch up with her and get to talk about all things Black maternal health. I hope you all enjoyed the episode. We'll be back with a regular episode next week. If you have any questions or topics you would love for us to cover, as always, feel free to shoot me an email. That's Jenny@reprosfightback.com. That's Jenny with an IE. Or you can reach out to us on social media. We're on Facebook and Twitter @reprosfightback, or we're on Instagram @reprosfb. Otherwise, I will see y'all next week. For more information, including show notes from this episode and previous episodes, please visit us at our website @reprosfightback.com. You can also find us on Facebook and Twitter @reprosfightback, and on Instagram @reprosfb. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.